Hi, this is the mini practicum abdominal assessment. My name is Lorraine Viel, and it's spelled Lorraine Viel. Okay, so I knock, wash my hands. Hi, I'm Lorraine. I'm the student nurse on the clinic today. Can I have your name and your date of birth?
Yeah, it's Michelle, December 14th, 1996.
Okay, great. And what's your reason for the visit today?
I have lower abdominal pain on the left side.
Oh, lower left abdominal pain?
Mhm.
Okay, good. So I'm going to be asking you a series of questions, and it's going to lead to probably a physical assessment. So then your stomach will most likely be exposed, and I'm going to be touching you and poking you and stuff. Will that be all right with you?
Yeah.
All right, great. So when did the pain start?
A week ago?
A week ago? Okay. Has the, what brought on the pain? Did you notice? What were you doing when the pain came on?
It started in the morning.
Okay.
I had just woken up.
All right. What does the pain feel like? What's the quality of the pain? Is it throbbing, stabbing, aching, dull?
Like a dull pain, but it doesn't go away.
Okay, so it's constant?
Yeah.
Constant dull pain?
Mm-hmm.
All right. Does it radiate? Does it move from one area of your abdomen to another, or is it localized?
It's localized.
So it stays in one area,
Mhm.
one spot. Okay. The severity of your pain, like from on a scale from 0 being no pain to 10 being the most extreme pain you felt, how would you rate your pain on that scale?
A 6.
So it's a 6. Okay. What treatments have you used? Just Tylenol, heating pad?
I've used Tylenol, but it doesn't help.
It's not
The pain
successful?
remains.
Okay, and what time of day does your pain seem to get worse, or you notice?
In the morning and then in the evening.
Okay. What do you think the pain is caused by? What do you think the problem is?
I haven't gone to the bathroom in a week.
Okay. Does this pain affect your quality of life?
Yes.
Okay, so I'm sure we can help you out with that today. Okay, so I'm just going to ask you some more questions. Do you have allergies?
No.
No? Okay, that's good. Are you taking any over-the-counter medications like vitamins or
No.
weight loss pills?
No.
Okay, do you take regular medications that's prescribed by the doctor?
No.
Okay. Do you take any recreational drugs or medication?
On occasion.
On occasion? Okay, that's fine. How's your appetite been lately? Does this affect your appetite?
Yep, I haven't been eating as much as I normally do.
Okay. Do you notice any changes in your weight? Any gains or any losses?
No.
Okay. Any difficulties swallowing?
No.
Any food intolerances?
No.
All right. Any nausea and or vomiting?
I'm a little bit nauseous.
Nauseated?
In
Okay.
the morning.
All right. How's your bowel habits? When's the last time you had a bowel movement?
My last bowel movement was 6 days ago, and
Okay.
I'm routine. I go every morning.
Okay. Abdominal issues, is there a family history of it
No.
in your family? Okay, so that concludes the assessment part, the health history. So now I'm going to do the physical examination, okay?
Okay.
So if you can just lay down on this table, on your back. Perfect. I'm just gonna move this chair. My darn dogs are so active today. Okay, so the first thing I'm gonna do is just inspect your belly. So I'm gonna move this up and I'm gonna lower this slightly. Okay, thank you. So what I do first is I'm gonna check for contour of your abdomen. So I'm just gonna bend over, reach over, and inspect that it's not rounded and it's not concave. It's nice and flat. Perfect. I'm gonna go to the end of your feet. Here I'm looking for symmetry, just to make sure both sides are symmetrical bilaterally, and they are. It is. So here I'm going to walk right over and I'm going to take note of your belly button piercing. It appears to be well healed. There's no drainage, there's no redness, and there's no swelling. And your umbilicus is symmetrical. I'm just going to take note of the color throughout your abdomen. It is homogenized color. I'm making note that there's no masses sticking out, there's no moles, there's no lesions, there's no surgical scars. And I'm going to also look for a aortic pulsation, which is about 2 inches over your umbilicus. And I'm just going to make note that you're breathing calmly. You appear relaxed and comfortable. Okay, so now I'm going to move on to the auscultation part of the assessment. I'm just going to take a little alcohol wipe here and just wipe this here. Okay. So the reason why I have to auscultate before I percuss and I palpate is to avoid obscuring the bowel sounds. So if I continue, if I start to palpate and all that, it might produce false bowel sounds. Okay? We don't want that. Oh, there we go. Okay, so I'm going to start on the lower right quadrant. If anything is sensitive, just let me know and I'll stop, okay? Okay, perfect. So there I was able to hear bowel sounds. I started in the right lower quadrant because that is where the most bowel sounds are heard. They're more active there. They sounded hyperactive. They were gurgling, and I heard about 5 to 30 bowel sounds in each quadrant, and that's normal. So if I wouldn't have heard that, if there was less, or if there was hypoactive or absent no sounds, then I would have listened to each quadrant for about a minute. Okay, so now I'm going to percuss. And here, I'm going to tap on, sorry, my hands are cold. Here we go. Sorry. And you're not sensitive anywhere?
No.
Okay, good. Okay, there I was listening for any dullness over your abdomen, because when you're laying down supine, all the air moves up to the top, so then I'm really able to hear any masses or anything like that. So we're going to move on to palpation. So I'm going to be pressing down in your stomach. If anywhere you're sensitive, please let me know, okay?
Yeah.
So I'm going to use the 3 pads of my fingers, and I'm going to be pressing a few centimeters up to 1 inch, okay? And here I'm going to, oh, I'm sorry. Did you want to go like this? So then you're going to focus on that instead of me pressing on your stomach, okay? It's not going to take long. Here we go. Perfect. You're not sensitive? You're good?
No. A little bit tender there.
Oh, okay, I'm sorry. All right, thank you. You did very well. The no masses noted. I noticed that there was a little bit of hardness around your left lower quadrant, but that could be because you are so many days, 6 days without a bowel movement, so it could all be collected in that sigmoid colon there. So thank you. That concludes my assessment, my physical assessment. I'll go give the information to the doctor and she'll be in soon, okay?
Thank you.
Thank you. Do you need help to get up?
No.
Okay, thank you.